Welcome to our enrollment meeting for our 2020 AARP Medicare Complete Medicare Advantage plans. My name is Lisa Deering. I'm excited to be here with you to share details of our plans and to help you enroll. You're smart to be here today. By doing your research early and enrolling now, you're free to focus on your family and your friends during the upcoming holidays. I'm proud to represent United Healthcare because of their strength, stability, and consistency of care and service. We have over 10 million members across the country, and we've been in the Arizona market for more than 30 years. According to Fortune magazine's 2019 World's Most Admired Companies list, United Health Group was included among the top 50 most admired companies overall. I'd like to introduce Jack and Diane. We're all licensed insurance agents with years of experience in Medicare solutions. As your agent, we'll make sure that all your questions are answered and help you make the best plan choice to fit your needs before you leave today. And we provide immediate, ongoing, local customer service after you enroll. Our first 45 minutes today is reserved for the presentation. The next hour after that is for answering your individual questions and helping you enroll. It's important that you know that you're not locked into a plan decision during the annual enrollment period. If you change your mind before December 7th, Medicare will allow you to switch plans as many times as you want. Take a look at a couple of the materials that are on the table in front of you. First of all, this optional information card, if you complete that, it allows us to make sure that all your questions are answered and that we can follow up with you. The top of the page is to write down the names of all your doctors so that we can find out if they're contracted with our plan. When you're ready, Jack and Diane will come around to pick them up. Now we're going to watch a very informative video covering the basics of Medicare and Medicare Advantage plans. And to do that, you're going to use the Clarity workbook that's on the table in front of you. You'll pay special attention to the information that has check marks next to it. Now, for the meetings that are using the Clarity workbook, let's turn to page 2 and talk about eligibility for Medicare plans. So you're eligible for Original Medicare Parts A and B if you're at least 65 years old. Or you're under 65, you might qualify on the basis of a disability or another special situation. And you have to be a U.S. citizen or a legal resident who's lived in the U.S. for at least 5 consecutive years. So when can you enroll in a Medicare Advantage plan or a prescription drug plan? Well, you've got your initial enrollment period. It's 7 months long. It's the month that you turn 65. It's the 3 months before you turn 65 and the 3 months after that. So on the middle of this page is a very nice little timeline. So let's talk about, first of all, the annual enrollment period, which we're in right now. So that happens every year between October 15th and December 7th. And this is when you can add, drop, or switch your Medicare coverage, which then, whatever change you make, becomes effective January 1st of the following year. Now, you'll receive a document called an Annual Notice of Change prior to the annual enrollment period, and that will detail the changes for your plan for the coming year. So you can say, yep, looks good to me, or maybe I want to look at some other options for next year. Then there's the Medicare Advantage open enrollment period between January 1st and March 31st. So this is only for folks that are already Medicare Advantage plan members. You can switch plans during this time, or you can drop Medicare Advantage altogether and go back to Original Medicare with or without a standalone prescription drug plan. And then finally, there are special enrollment periods available throughout the year for folks that are retiring and losing their employer coverage, if you move out of the planned service area, and if you receive assistance from the state or the federal government. Now on page 3, let's talk about your Medicare choices. First of all, This is your ticket to play. So you have to have Original Medicare Parts A and B. Once you've got that, then you have a couple of options which are down at the bottom of the page. So the first option is option 1, and that is a Medicare supplement. With a Medicare supplement, you can choose the level of coverage that you want, and it will pay some or all of what Original Medicare doesn't cover. You'll pay premiums based on the amount of coverage that you choose and your age, and you'll pay those premiums monthly. No Medicare supplement plan includes drug coverage, so you'll also need to choose a prescription drug plan, and you'll also pay a monthly premium for that. Your other option, which is the focus of today's meeting, is a Medicare Advantage plan, also known as a Part C plan, which covers everything that Original Medicare Part A and Part B covers. Usually includes Part D, which the plan we're going to talk about today covers, and offers additional benefits beyond what Original Medicare covers. And this is where people say, well, that sounds too good to be true. How can you do that? Well, the payments we receive from Medicare help with the cost of those additional benefits. Let's look at page 4 and compare coverage. So you'll see all the benefits that Medicare Advantage covers. And then you'll see Medicare supplements and Original Medicare do not cover prescription drugs, routine vision care, routine hearing exams, or hearing aid coverage. In addition, Original Medicare doesn't have any protection against limiting your out-of-pocket costs for the year. So your liability could be unlimited with that. On page 5, let's notice the Medicare Advantage difference. So more coverage than Original Medicare, such as prescription drug coverage, annual physicals and screenings, worldwide emergency care, and that out-of-pocket spending limit, which is your safety net. Also, we found that folks that have Medicare Advantage versus Original Medicare have fewer hospitalizations. When they're hospitalized, they spend less time in the hospital and spend overall less on their health care than folks with Original Medicare. So what makes you eligible for a Medicare Advantage plan? On page 6, you'll see that, again, you have to have Medicare Part A and Part B. You have to live in the plan service area. These plans are specific to the county that you live in. And you can't have end-stage renal disease. There's some exceptions to that rule, but in most cases, if you have kidney failure requiring dialysis, Medicare doesn't allow you to change plans. Now, we also have a special plan for folks that are dual eligible, meaning that they have both Medicare and Medicaid, which we call Access in the state of Arizona. If that applies to you, come talk to us after the meeting and we'll see if you qualify for that. On page 7, there's 10 important things that you need to know about Medicare Advantage plans. One is that you must continue to pay your Medicare Part B premium. Number 2, if you join a Medicare Advantage plan, it's typically going to affect your current coverage. This is especially important if you have an employer or a retiree plan. So check with your benefits administrator before you change, because you might not be able to get that coverage back. Number 3, it's best to use network providers. So this type of plan is built around a network of providers that provide your care. And if you go outside the network, lots of times, most of the time, you're going to have to pay out of pocket. But in an emergency, you can use any provider. Number 4, you might qualify for financial assistance, such as a low-income subsidy called Extra Help, paying for your drugs through Social Security. Number 5, if you enroll in Part D, that's your drug coverage, late, you may pay a penalty. So Medicare wants you to have drug coverage from the time you first become eligible for it. If you go without it for more than 63 days after your initial enrollment period, Medicare will charge that penalty, and that will last as long as you have that Part D drug coverage. So when you get the letter of creditable coverage from your current insurance company, keep that because you might need to submit it as proof that you've had coverage in the past. Part D penalties generally don't apply if you're receiving extra help from the government. Number 6, a Medicare supplement plan, which a lot of people call a Medigap, is not the same as a Medicare Advantage plan, and you can't have both at the same time. When you enroll in a Medicare Advantage plan, you're going to get an ID card. You're going to keep this handy. You're going to show it when you see any provider, whether it's the doctor, the hospital, or the pharmacy. You're going to put this card in a safe place because you're not going to show it when you're on a Medicare Advantage plan. So lock it up in a file or in your safe. Number 8, Medicare Advantage offers the same rights and protections as original Medicare, such as the right to file appeals and grievances. Number 9, Medicare offers more than original Medicare, and we'll talk about that more in depth. And you have that built-in safety net, which is your annual out-of-pocket maximum. Turn to page 8 and let's talk about the rules for prescription drug coverage. These rules are the same whether you have a drug plan from United Healthcare or any other carrier. So Medicare sets these rules and all the insurance companies have to follow the rules. The first stage is the annual deductible. So if your plan has a deductible, you're going to pay for your drugs until you reach the set amount that the deductible is set for your plan. After you satisfy the deductible, you move into the initial coverage stage. So in this stage, you pay part of the cost of your prescription and the insurance company pays the rest. You'll stay in this stage until the total drug cost, what you pay and what the health plan pays, reaches $3,820. If you go past that, then you enter what's called the coverage gap or the donut hole. This is kind of a painful stage where you're going to pay 25% of the cost of your brand name drugs and 37% of the cost of your generics. And you stay in this stage until your total out-of-pocket costs reach $5,100. After that, you enter the fourth and final stage called the catastrophic coverage stage. I call it the light at the end of the tunnel because this is where your costs go way down. These stages are an annual cycle, so come January 1st of each year, you push the reset button and it starts all over again. Now there's some rules that you have to follow when you have a prescription drug plan, and those are listed on page 9. So let's talk about using a pharmacy network to fill your prescriptions. Not a problem when you have a United Healthcare plan because we're contracted with more than 65,000 pharmacies across the country. There's a formulary for every plan, which is simply a listing of the drugs that are covered by the plan. The formularies are tiered, meaning that drugs are arranged according to their price. So starting with Tier 1, these are the least expensive drugs that are preferred generics. Tier 2 are generics, Tier 3 are preferred brand name drugs, Tier 4 are non-preferred drugs, and Tier 5 are specialty drugs, and they are the most expensive. Step therapy is a good way to possibly delay your entry into the coverage gap and save you money on your prescriptions by offering lower cost drugs, and you'll start out at the lowest step drug that will treat your condition. And in the same way, if that doesn't work for your condition, you'll step up to the next most expensive drug. So step therapy, start with the lowest cost. Quantity limits are in place to cover only a certain amount of a drug or a certain number of days. It's to make sure that drugs are used safely and effectively. So consider an opioid prescription. You're not going to get a 90-day supply because certainly that wouldn't be safe. So there are some drugs that have those limits. Prior authorization might be needed to make sure that a drug is medically necessary and to make sure that it's being used correctly for a medical condition that's covered by Medicare. Sometimes you need an exception either to the formulary, so there might be a drug that's not covered on the list that you might need, or a restriction on the limits of your drug, and that's called a utilization exception. In both cases, the doctor's going to submit an exception if you need it, and United Healthcare is not going to keep you waiting. Generally, within 72 hours, a decision's going to be made on that exception. On page 10, let's talk about how United Healthcare goes beyond expectations. So one size doesn't fit all when you're looking at healthcare. So those of us in the room today can help you choose the right fit for your needs. So we have lots of choices and we have lots of guidance. We have customer service advocates that put you first. We also are here to stay. So you can rely on us to be around. We're not going out of the market tomorrow. We've been around for more than 30 years. So you can trust us. We're stable and we're secure. We're also the only Medicare plans that carry the AARP name. So we do have that exclusive relationship with AARP. I want to tell you on page 11 about our Renew program. This helps our members live a happier, healthier life. So we have lifestyle tips and learning activities. We have videos and recipes and interactive health tools. We have this fantastic magazine that comes periodically. And there's things in here like the games that I just mentioned. And my personal favorite, I always go right for these healthy recipes that are included. But there's many different pieces to this Renew program, including our Renew Active Fitness program that I'll tell you more about in just a moment. Now on page 12 are some decision-making tools, but we're going to come back to that in a moment. Before that, I want to move on to page 13 and talk about resources that are available to you. First and foremost are those of us that are agents in this room. We're your primary resource today and throughout the year. So when you enroll with us, you get us as your primary resource. Then there's the Medicare helpline. You've got the phone number and the website there. For the Social Security Administration, if you want to apply for extra help, the website and the phone number are there. And don't forget about the state's Medicaid office or Access in the state of Arizona. One that's not listed here is the customer service number that's going to be listed on the back of your card. You'll use that for everything after enrollment, including if you need to disenroll, cancel, or withdraw an application. On page 14 are some things to consider before you enroll. So find your current Medicare status and eligibility and make sure to look at those points. Now we've seen the video and it had some great information on Medicare and Medicare Advantage plans. And now we're going to do a quick comparison on the plans that are available here in the Valley. So this little sheet here, it's a long sheet that's sitting on the table in front of you, will allow us to compare our AARP Medicare Complete Plan 1, which is in the middle column, and our AARP Medicare Complete Plan 2, which is on the right-hand side. So let's take a look at the plan benefits and compare the two plans. The monthly plan premium is $0 for both plans. To see a primary care provider on Plan 1, you'll pay a $10 copay. To see a primary care provider on Plan 2, you'll pay a $0 copay. If you need to see a specialist under either plan, you'll pay a $45 copay. Preventive services, which include so many things, including flu shots, pneumonia vaccines, bone density tests, pap smears, mammograms, colonoscopies. These are a $0 copay under both plans. If you're in the hospital as an inpatient under Plan 1, you'll pay $250 per day for days 1 through 7 and a zero copay after that. For Plan 2, it's a $225 copay for days 1 through 7 and zero copay after that. Now, what you should know about United Healthcare if you're shopping amongst other plans is that there's not going to be any surprises or any additional bills for your inpatient hospital stay. So we don't do any kind of carve-outs if there's any doctors that aren't contracted with the plan coming to see you or something like that. Outpatient surgery, think cataract removal. If you go in the morning and come out in the afternoon, you're going to pay a $175 copay under either plan. And that's for the doctor, the anesthesiologist, for the facility. For lab services, if the doctor doesn't do it in-house, you'll pay a $3 copay under both plans regardless of the number of vials of blood that are drawn or the number of tests that are done. Outpatient x-rays under Plan 1 are a $14 copay, Plan 2 an $8 copay. If you need a ride in an ambulance, whether it's wheels on the ground, a helicopter, or an airplane, whatever it takes to get you to the care you need, you'll pay a $230 copay under Plan 1 and a $200 copay under Plan 2. Emergency care is a $90 copay under both plans. Remember that your emergency coverage is worldwide, and if you're admitted to the hospital within 24 hours, that emergency copay is going to be waived. If you need urgent care, you're going to pay $30 for a contracted facility and $40 out of network. What you should know is that we have mobile urgent care that will come directly to your home in certain zip codes. So check with us after the meeting to see if you're in one of those zip codes. There's no deductible on either plan for your medical expenses, and the annual out-of-pocket maximum or your safety net for Plan 1 is $4,300 and Plan 2 is $4,000. Now at the bottom of that sheet, take a look at the comparison between the additional benefits, services, and programs. One of the things that I want to point out to you is the over-the-counter benefit that's available under both plans. So this is $80 per quarter or $320 per year to buy everyday over-the-counter health products such as pain relievers, stomach remedies, cough and cold medicines, toothbrushes, toothpaste, even adult diapers. You'll receive a catalog. You simply order from the catalog and have these products sent directly to your home, so it's convenient, and you'll stock up your medicine cabinet with things that you'd probably want to run to Walmart or Walgreens to buy. So make sure once you enroll, you don't leave this benefit sitting on the table. Now on the back of that sheet, you'll see a comparison for the drugs between Plan 1 and Plan 2. So let's talk about costs for a 30-day retail supply if you were to go into the drugstore and pick up your drugs. For Plan 1, you'll pay a $3 copay for Tier 1 drugs. Under Plan 2, a $2 copay. Tier 2 drugs under Plan 1 is a $10 copay. Plan 2 is an $8 copay. Tier 3 drugs, Plan 1 and Plan 2 is a $45 copay. Tier 4 drugs, Plan 1 and Plan 2 is a $95 copay. Tier 5 drugs under Plan 1 is 30% coinsurance. Plan 2 is 33% coinsurance. Plan 1, the annual deductible for Tiers 1 and 2 is $0. There's a $150 deductible for Tiers 3, 4, and 5. Under Plan 2, there is no deductible for any of the tiers. So that's a little comparison between the two plans that we offer. Now that Jack and Diane have passed out the enrollment guide, we're going to focus on the AARP Medicare Complete Plan 1. And we are not going to recover the benefits that we just talked about, but I do want you to turn to page 5 and let's review how an HMO plan works. HMO stands for Health Maintenance Organization, and what that means is that there's a network of providers that you're going to use. First thing you need to do is select a primary care provider. We'll help you do that today. And that primary care doctor, or PCP, is going to coordinate all your care, including sending you to specialists and providing a referral for that. Now, you have emergency care coverage, either emergency care or urgent care, no matter where you go. And there's a network of providers that if you stay in the network, you're covered. If you go outside the network, generally you're going to pay out of pocket with that emergency care exception. Down at the bottom of page 5, there's a reminder about that Part D late enrollment penalty. Now let's turn to page 8, and I want to, first of all, revisit the specialist, because when you have a United Healthcare plan, we have an express referral process, which means that you're not going to wait for approval from the plan to go see a specialist. The primary care doctor puts in an online referral, and as soon as you can get an appointment with your specialist, you go. You don't have to wait for United Healthcare to approve that. So compare that with other plans that you may be looking at. Let's skip down to skilled nursing facility. With this plan, there's no prior inpatient hospital stay before you can go into a skilled nursing facility, as there is with original Medicare. You'll pay a $0 copay for days 1 through 20, $160 copay for days 21 through 47, and a $0 copay from day 48 through 100. If you need diabetes monitoring supplies such as test strips, lancets, and monitors, you'll pay a $0 copay. If the doctor orders medically necessary home health care visits, you'll pay a $0 copay. For diagnostic radiology services such as an MRI or a CT, you'll pay a 20% coinsurance. Now that's 20% of the cost that United Healthcare contracts with the provider. So you can easily call ahead, tell the provider the exam that you're getting, and tell them the name of the plan that you have, and they'll be able to provide you with the dollar amount of that coinsurance. Same with diagnostic tests and procedures, you'll pay a 20% coinsurance. Now let's go to page 9 and talk about benefits and services beyond what original Medicare offers, such as a hands-on routine physical every year for a $0 copay. Routine eye exams are a $20 copay every year and no referral is needed. If you need glasses or contact lenses, you'll have an allowance of $70 for frames and lenses or $105 for contacts. If you need a hearing exam, it's a $10 copay, and that's every year. Just so you know, people who are diagnosed with Alzheimer's, up to 30% every year don't actually have Alzheimer's. They have hearing loss. And because they're not able to hear, they exhibit symptoms of Alzheimer's. So go get your hearing checked. It's only $10 a year. If you do have hearing loss, our subsidiary, High Health Innovations, offers deep discounts on hearing aids, starting at $330 for the over-the-ear device and $380 for in-the-ear canal. You can purchase 2 of those at that price every year. If you've ever priced hearing aids, you know what a savings that is. Now, a little bit more about our Renew Active program. This allows you to join a gym at no cost. So there's many gyms throughout the valley that are contracted. You simply call and find out what gyms are available. You can go online, and once you get a generated code, either by calling or going online, you go sign up at the gym, and then you can go for free. And there's no cost. You can join as many facilities as you want. So motion is lotion, stay active. Solutions for Caregivers is a great resource. You'll be linked up with an experienced care managers who can help if you're caring for a loved one or if somebody is caring for you if you're a caretaker. 24 hours a day, 7 days a week to link you to resources that are available in the community. Diabetics need routine foot care, and so you're allowed up to 6 visits per year for a $45 copay with a podiatrist for that specialized foot care. And the nurse line is available 24 hours a day, 7 days a week. These folks have years of experience to help you with things like prescriptions, symptoms, even help scheduling appointments. So it gives you the peace of mind to know that you're never alone. Even at midnight on Saturday night, you can call and get some help. Virtual mental health visits are available to speak to a mental health expert using your computer or your mobile device for a $40 copay. So we're going to transition now from the medical benefits to prescription drugs. And under this plan, we've already talked about the deductible and the costs in the initial coverage stage. And I want to let you know about our preferred mail order service available through Optum Rx. This is a great way to spend the least amount possible on your prescription drugs and have the convenience of having prescriptions mailed directly to your home. So if you use this service, you'll pay a $0 copay for any drugs that are in the Tier 1 or Tier 2 pricing category. There's savings in Tier 3 and Tier 4. You'll pay $125 for Tier 3 and $275 for Tier 4. And for Tier 5 specialty drugs, it's a 30% coinsurance. We already talked about costs in the coverage gap stage. Should you spend through that and go into the catastrophic coverage stage, you're going to pay anywhere from $3.40 for generics to $8.50 or 5% coinsurance for all other drugs. Turn your attention to page 11, and I want you to know that if you set up an online account after you've enrolled, you can easily track how close you're getting to the coverage gap by setting up an online account. So I really recommend that. On page 12, you'll see the website where you can register with Optum Rx for that home delivery, and also a reminder about checking with Social Security to get that extra help paying for your prescriptions. So we've talked a little bit about the additional benefits that this plan offers beyond original Medicare. I want to share a couple of others starting on page 13. One of them is My Advocate. So you may be eligible for government or community assistance programs that you don't know about. So this is a financial checkup where they'll help you find out if you are eligible for that. Another program that's unique that you'll only find with United Healthcare is a program called Navigate for Me. So this provides a great source of comfort and support for you and for your family when you have complex chronic health issues like diabetes or chronic congestive heart failure, or you have a sudden health event like a hip or a knee replacement or a cancer diagnosis. Navigate for Me is a single point of contact for a personalized plan to help guide you through the clinical and financial requirements specific to your health needs. And so that's a great help when you don't want to be worrying about the financial aspects or coordinating appointments and stuff when you have a health crisis. On page 13, let's look at the Passport program. This is a wonderful benefit for those of you that are snowbirds. So this program allows you to access all the benefits that you have at home when you travel in one of the 33 shaded states that you see on the map there. Now, under the states are counties that participate, and before you travel, you simply call customer service number on the back of your card, tell them where you'll be traveling and when, and then when you get there, you pay your usual copay or your coinsurance for regular care, And you can use this for up to 9 months at a time. And then when you return home, you simply call to deactivate. On page 19 is a supplemental benefit called the Platinum Dental Rider. So this will make you smile if you need dental coverage. You can add this at any time, either now when you enroll or after enrollment. There's no waiting period, and it's $39 a month premium for this service. And if you're interested, we can tell you more about this program after the meeting. So we'll sit down and explain that to you. Moving on to page 29, I want to show you that you have a summary of benefits in the book. This is more involved than what we covered under the benefit highlights. We're not going to cover it now, but I do want to point it out. And I also want to let you know that after you enroll, you have access to your evidence of coverage document, which is more than 200 pages, and it details every aspect of your insurance. The next page we want to look at is page 41. Take a moment to dog-ear this page because it is the vendor information, the contact information for all of the ancillary products that are part of your plan, such as if you want to know how to schedule a hearing exam, you've got the phone number and the website there. If you want to order from the over-the-counter essentials catalog, you've got the phone number and the website. Same for the fitness membership. If you want to find out which gyms participate and generate the code to go get signed up, that information is there. Page 43 is some very information on Medicare star ratings. So every year, Medicare rates every Medicare plan and awards stars based on how well the plan performs for its members. So 1 star is poor and 5 stars is excellent. This plan was awarded 4 out of 5 stars for 2019. There are no 5-star plans currently in the state of Arizona. If you want to know more information about star ratings or if you want to compare, you can go online to medicare.gov or call the 1-800 number that's listed there at the bottom of the page. Page 45 tells you that we don't treat members differently, and we'll also provide this information and your health information in various ways and in different languages, and we do that at no cost to you. The drug list starts on page 48. Now, this is an abbreviated list. It's not the complete list, so if you're looking for a drug that you don't see listed, check with us after the meeting and we'll look it up for you. But these are the ones that people ask about most often. The drugs are arranged alphabetically, and anything that's in bold font is a brand name drug. Anything that's in plain font is a generic drug. And next to each drug is a little key for the pricing tier. So T1 is tier 1, T2 is tier 2, and that corresponds to the costs of the drugs that we covered back on page 9. On page 81 and 82 is a list of alternative covered drugs. So these are ones that folks ask about that may not be covered under the plan and the options that we provide for those drugs. So we got you covered regardless of what you need. All right, now it's time to fill out the enrollment application. So turn to page 87 and grab your Medicare card and put that on the table right in front of you. You're going to use that to complete this application. So starting on page 87, information about you. Your name, both your first, last, and your middle initial, must be written in exactly as it appears on your Medicare card. For your birth date, don't put today's date. For the permanent residence street address, this must be where you live. Nobody lives in a post office box, so put down where you actually live. And then if you want your mail to go to a post office box, you can list that below your physical address. Moving on to page 89, again, you're going to fill in the information about your Medicare with your name and your Medicare number from your Medicare card. Let's turn to page 93. And question number 2 at the bottom of the page is really important. Do you have end-stage renal disease? Now, if you're not on dialysis for permanent kidney failure, please check no. This is a real showstopper for your application. On page 97, question 8 at the top of the page says, please give us the name of your primary care provider, your PCP. We will help you with that and also with providing the number of that primary care provider. And finally, on page 99, when I sign below, it means I've read and understood the information on this form. So sign as your name appears on your Medicare card and put today's date, not your birth date. So that's the application, and those tips will help you prevent enrollment delays. Now, let's look at the inside back cover of your booklet and what you can expect next after you're enrolled. You're going to get a verification letter, you're going to get lots of stuff in the mail, you're going to get a welcome call, and you're going to watch for your ID card that comes in the mail. On that ID card, you want to check to make sure that your primary care provider is correct, and note that the customer service number is on the back of the card. You'll also have a member ID number on that, and you'll use that member ID to set up an online account. Down at the bottom of the page is the website, myaarpmedicare.com. So registering online will allow you to track your claims, see where you're at as far as your drug coverage, find providers and pharmacies in the area, and remember that you can also call customer service anytime you need to. Now, we've covered a lot of ground, and by enrolling today, you won't waste time setting up another appointment. You're all set for another year without having to rush just before the deadline. And a reminder that if you find a plan that you like better between now and December 7th, you can enroll in it, and today's enrollment will be canceled. But most of all, we'd be honored to have you as members of our United Healthcare family. So now we're going to get into groups and help you with the doctors in network. We're going to answer your questions, help you complete those enrollment applications, and provide our contact information. Thank you very much.